My name is Katie, and this is my sister Trisha, and today we are doing a nutrition counseling session. We are doing this because as a dental professional, it is our responsibility to explain to our patients the types of food that they are eating, which ones are good and which ones are bad, and relate them to caries risk and overall oral cavity health. So hopefully by doing this, we can find any areas that might put you at risk and possibly make some changes so that you don't end up with many or any cavities. So before we got started, I had you fill out a health history form, and we also did an intraoral and extraoral exam. So from your health history form here, some things that we want to take into consideration for your counseling session today are that you are not taking any supplements, which is actually really good, so you're solely relying on your diet for your nutrition and nutrients. You are also not taking any birth control, and you occasionally drink some alcohol, correct?
Correct.
All right, and those two things can actually affect the way things are absorbed or if things can be absorbed in your body. So we'll just want to remember that. And then from your intraoral and extraoral exam, there was nothing that stood out as a particular problem or concern, nothing that's going to keep you from getting the nutrients or altering your diet in any way, such as diabetes or a dry mouth or anything that way. So that is good as well. Before we get started, there's some terms here. I've made this flip chart that will kind of aid me through your nutrition counseling session. There's also some extra information you're welcome to read as well. But some terms here that we want to understand are caries, which is dental decay, or also known as cavities. Cariogenic, which are foods that promote the formation of caries. And then non-cariogenic, which are foods that do not contribute to decay on your teeth. So, do those terms make sense? Is there anything that's unclear about them?
Nope, they make perfect sense.
Awesome. I also had you go through your list of what you had for your diet and highlight the foods that you felt were cariogenic or caused decay. And you highlighted everything except water, which means you think everything except for water is causing decay in your mouth. Is there any particular reason why you think that?
I just think that water is the most natural out of all of them, and in some way, shape, or form that these foods have something that makes my teeth decay in some type of way.
Okay, perfect. I mean, I guess that kind of goes along with, they rinse your mouth with water at the dentist. They wouldn't be doing that if it was causing decay. So I also went through and highlighted what is actually cariogenic on the same list. You have everything on here correct except for your protein sources. Those are actually going to be the non-cariogenic or not contribute to decay. So on your list here, that would be the peanuts, the meats that you ate, the beef from your cheeseburger and chicken from the chimichanga. Those don't actually contribute to decay because they're protein. Fats and sugarless gum are also in the non-cariogenic, don't contribute to decay as well. You're getting those in your diet. So all of these highlighted foods that we have here are actually going to help cause cavities in your mouth from this list that I've provided here. And the thing that they all have in common is they all contain sugar. So sugar is going to be the main culprit for the caries process, which is how cavities are formed. So you have normal bacteria that's just living in your mouth and around your teeth and oral tissues. And when you eat sugary foods such as the ones here, the bacteria also in your mouth will feed off of the sugar in these foods as well. As a result, the bacteria produces acid as a byproduct. And if this acid is allowed to stay on your teeth surfaces long enough, it can cause the outer layer to break down. And when this happens, it's when cavities begin to form on your teeth. So, concern for many dental professionals is the amount of carbohydrates that you're consuming. Carbohydrates can be classified as either a simple or a complex carbohydrate. The simple ones here begin breaking down in your mouth, which makes them an ideal source for the generation of caries. They also provide a quick source of energy for you since they're rapidly digested. Some sources of simple carbohydrates include sugars, milk, dairy products, ripe fruit, fruit juice, and even alcohol. So complex carbs are a little bit different in that they take longer for your body to digest, so they don't have a strong of an effect on the caries process as the simple ones do. They also contain vitamin and minerals that are essential for your overall health as well. And some sources of complex carbohydrates would be vegetables, whole grains, and unripe fruit. So the food pyramid that you might remember from back in the day has now been changed a little bit. It's now My Plate, and it differs a little bit from the old school pyramid in that the majority of what you should be eating should be grains and vegetables. With the grain portion of it, they'd like at least half of the grains to be whole grains, and then you just need to get a variety of vegetables. They'd also like you to include a variety of fruits, and then make sure you're getting some protein and dairy as well daily. So I entered all of the food that you ate for this session here at myplate.gov, and we printed out a sheet that shows the summary of the different food groups and whether you met the daily values or not. And in the summary here, it shows that you were very close on the amount of grains and dairy that you consumed. The only thing to take note with the grains is that most of your grains were refined grains, which are going to be the simple sugars that will contribute to the decay, and not so many whole grains, so we'd like to see an increase in the whole grains if we could. An easy way to do that is there's whole grain breads or pastas out there. You can also find many other products with whole grains, crackers and things like that as well. Again, I also said dairy was also a good one, which is awesome because that is a great source of calcium, and we need calcium for the growth and maintenance of our teeth and bones, keep them strong. And even though milk is a karyogenic food and dairy products are, it's still an important part to get that incorporated into your diet daily. From here, we can see that you did not meet the requirements on the vegetables, fruits, or proteins. And I'm not sure if this is an average thing or what you eat every day, but is there any particular reason why we weren't getting any fruits and vegetables?
It was just the weekend, and I was more hectic that weekend, and it was just simpler to grab the food that I grabbed, and fruits and veggies just weren't really provided of where it was at.
Okay. Yeah, that can happen sometimes. It's everyday life. Are there any fruits or vegetables that you do like to eat and maybe do eat more daily on a daily basis?
Grapes, raspberries, blueberries, strawberries, bananas. Just simple ones I can just pick up and go since I'm always on the go.
Okay, perfect. Any vegetables you like to eat?
Potatoes, corn, spinach, and then sweet potatoes from time to time.
Awesome. Just writing down some of these so we need to make some changes. I've got some things here that we can work with that will be beneficial to you. So along with the food group summary, I also have a nutrient report here that's printed out. So based off of what you're eating, it'll take nutrients and let us know whether you met the areas of the nutrients that you need daily or not. Most of the things that you were meeting on, but there were a few that you were a little bit under on. For the vitamins, you were under in vitamin D, E, and K here. And then under the minerals, you were under on potassium, magnesium, and iron. But I think we'll notice that, you didn't get any fruits or vegetables that we'll find a lot of those in those sources. So if you just increase those sources, we'll be able to get those nutrients back in. Mm-hmm. So the vitamins D, E, and K actually are fat-soluble vitamins, so your body can store those for a few months' supply at a time. So it's not something you need daily, but definitely something you need because deficiencies can cause problems, and we don't need any problems, right? Okay. So a vitamin D deficiency can cause osteoporosis, which is the weakening of your teeth and bones because it helps calcium absorb, and you're definitely getting plenty of calcium, so we'll want to increase the vitamin D. Vitamin D is also known as a sunshine vitamin because it is something that your body can actually make with the help of sunshine. Is there something that you're able to do outside, or can you get outside at all?
Yeah, I coach softball.
Oh, perfect. So you're probably outside a lot with some practices and games.
Yep.
Very cool. Well, your body only needs to be out in the sunlight 5 to 10 minutes, 2 or 3 times a week. Probably a little more out in the sun for you with all the softball.
Yeah,
but yeah, so that means you're absolutely getting enough time in the sun for your body to make adequate amounts of vitamin D for you. And so you can also get your calcium absorbed as well. That's great. Vitamin E was another vitamin that was a little bit low. This one is used in preventing oral cancer, and it's also an antioxidant, meaning it helps your immune system work and operate correctly. And it also plays a role in keeping your heart and cardiovascular system healthy. We want to keep our heart healthy because our teeth are alive and they are supplied with their own blood vessels and nerves, so we need to keep our heart healthy to keep our teeth healthy. You did state earlier that some vegetables you like to eat, one would be spinach, and vitamin E is actually found in salad oils, so if you're eating like salads that are made out of spinach and getting some salad oils on there, that'll be a way that you can get your vitamin E source in. Vitamin K is the other one. It's a little bit of a weird one because it's not actually made by you. It's made by bacteria that lives in your intestines, but it helps increase your bone density. We need to keep strong teeth. Its absorption can decrease if you have high levels of vitamin E, but some sources of vitamin K would include leafy green vegetables such as collard, spinach, broccoli, and celery. Do any of those besides the spinach sound like something you would eat?
No.
No. Okay. Just making notes here so that when we look back at what you're low on, we've got some resources to use. And the other vitamin that's a little less important for you particularly is going to be choline, which is a B complex vitamin. It's more necessary for women that are pregnant or going through menopause, but since it's part of the B complex, it's needed because all the B complexes work together to help keep your mouth healthy. So some sources of this would be broccoli and cauliflower. But like I said, it works together with all the B vitamins, and B vitamin deficiencies can cause many oral problems such as angular cheilitis, which is the swelling of your lips, especially around the corners, and that can be very painful. Halitosis, which is very bad breath. Even if you think your morning breath is bad, this is going to be a lot worse. And glossitis, which is a sore or possibly swollen tongue. So I don't think any of that sounds like fun. So just need to make sure we get some of that. I mean, you are getting some. It just says that you're under. So just later down the road, menopausal and pregnancy, just something to keep in mind for you. We also know that a couple of your minerals were low. The first one we'll take a look at is potassium. There any food sources that possibly come to mind that might contain a fair amount of potassium for you? Bananas, yes. Awesome. Glad you said that. They are a great source to get potassium from, and will also increase the amount of fruit for your daily intake since that area was a little bit low. Potassium deficiencies can cause abnormal heart rhythms and muscle weakness, which would include your heart since that is a muscle. And as I stated earlier, we need a healthy heart for healthy teeth. Keep that in mind. Magnesium was another mineral, and magnesium aids in bone growth and helps prevent any skeletal abnormalities. It's what helps you keep your posture and keep you upright and from collapsing, your skeletal from collapsing on itself. So 2/3 of the body's magnesium supply is found in your bones and teeth, so when sources get low, your body will go to your bones and teeth to get the magnesium it needs. And we don't want that. We need to keep our teeth strong. A deficiency can also cause an irregular heartbeat and a fragile alveolar bone. So the alveolar bone is the bones that will house your teeth. So we want to keep that strong so that we're not losing teeth and we can keep our teeth in, keep getting the proper nutrition that we need. Some sources where magnesium can be found in foods would be almonds, cashews, soybeans, whole grains, and bananas. I know you said bananas are something that you would eat as a fruit. Are any of those other foods I just mentioned anything that might interest you and something you could eat?
The almonds, cashews, and then the whole grains.
Okay. Perfect. All right, make note of that. And the last mineral that you were low on was iron. Your level of iron was actually very close, if you take a look here, to what you need daily, but still a little bit low according to the myplate.gov site. And iron actually aids in the formation of hemoglobin, and hemoglobin is what is in your blood that the oxygen will attach to, enabling oxygen and nutrients throughout the body, which would include your teeth and then also the oral tissues in your mouth as well. So oral complications that can arise from this deficiency would be oral sores, angular cheilitis, which is again the swollen lips, and a sore or burning tongue. Any ideas on what kind of foods might contain iron? Okay, that's fine. Actually, dried beans, nuts, egg yolks, the potatoes with the skin, and some enriched cereals would contain iron. Again, do any of those sound like a source that you could get iron from?
The nuts, egg yolks, potatoes, and then the cereal.
Okay. For the cereals, you'll just want to look, at the label and make sure that it is containing iron, because some do not. But in summary here, I have written down, with each deficiency, some things that you could use or eat to increase those, and then also the fruits and veggies that you like to eat, just as a daily reminder for something you can help you to get those intakes up. But I'm let you take this with you today. I'm definitely not asking you to eat all of these daily, but even if you can try it to add some of these fruits and veggies just, a couple times a week, that'll definitely improve your overall oral health and get you in the right direction for a healthier mouth. Does that sound something attainable that you could do? Or
yeah.
Okay. Is there any suggestions or changes you would like to make to this list or anything I've said?
Nope, looks pretty good.
Okay. Well, as we've just discussed, deficiencies can be bad, but so can overages. The only thing that you were over on was the amount of sodium here. We'll take a look. It was almost double. That can be very bad because too much sodium can cause heart disease, high blood pressure, and also dehydration. There's some easy ways to limit the amount of sodium in your diet, such as eating some fresh foods over processed ones, eating some less salty snacks because sodium is salt, and then preparing foods with sodium-free spices. So on average, the main culprit of these high sodium levels is probably going to be due to processed foods. And it looked like, in the morning you're eating some more processed foods. I'm sure first thing it's a little bit hard to wake up and want to make some breakfast, especially if you're trying to run out the door on the weekends and stuff. But if you could, just limit the amount of processed food in your diet, that'll definitely help take that number down. Does that sound like something reasonable that you could try to do?
Yeah.
Okay, awesome. So I'd like to finish on a positive note with you, though, saying that you did a great job of getting adequate amount of water daily. Not only are our bodies composed of about 50 to 60% of water, but water is also used daily in many operations performed by our bodies as well. And rinsing with water after every meal can actually help reduce the cavity rate in your mouth, since it'll help get some of that sugars and stuff away from your teeth. I'd like to go ahead and ask you if there's anything that you've learned so far from this activity today.
Just obviously my intakes and what I was under and what I was over on, and how to kind of control it more now.
Yeah, it's a little surprising. I didn't know this much information either before I started going in the oral health area. So yeah, it's very interesting to look at foods and see what everything's going into your body. But thank you for sitting down and talking with me, taking the time to do this. I appreciate it. Hopefully we've discovered some things that maybe you didn't know and you can learn from and take with you and help improve your overall oral health for the future. Thank you.